extent we have made some progress there. In terms of public health, in my answer online, there are discussions about using technology to even track the movement of the virus in the terms of persons who are infected. I don't know that we have yet adopted it because there are some challenges regarding, and Richard alluded to them too, confidentiality. So the idea here is a person who is tested positive, if they are going to be, say, put on voluntary quarantine, their phone numbers, wherever their phone numbers using the technology, Bluetooth, etc., can alert a central location as to persons that they have come into close contact with, and therefore able to do checks on those contacts. That is vaguely the idea here. We may have to consider that. I know there are some regional app producers who have contacted us to try to use that. I've seen online where some of the developed institutions and organizations are discussing it. But yes, certainly that is one of the things. Also, you may have read about, even in the industry, the use of 3D printing to produce certain parts of things that we need. But as I said, there are opportunities. It's for us to identify them and for our private sector to work with technical institutions for developing them and putting them to market. Over.
Laverne, you wanted to say something about technology?
Yeah, I absolutely agree with those remarks. And I just want to emphasize, again, looking at the American business model. They are looking at an emphasis on AI, artificial intelligence. So from the perspective of the government structure itself, within government, running actual governments, the systems must be updated in each Caribbean country to be able to adapt and also interface when they're dealing with the rest of the world. That's critical. Then you have the issue of education, schools, virtual, online. I will speak to the role of women, many women, single mothers or married, having to work but having children at home, doing work online. So education in a different form and fashion. And then technology as a whole as a way to replace the tourism industry. Tourism, I'm in Orlando, which is the #1 tourist destination in the world. They here are trying to reimagine and restructure. They have set up several task force here because Orlando runs on tourism. And you have Disney and Universal shut down, and for the foreseeable future, it may not get back where it was. They're addressing that here. In the Caribbean as well, tourism. So technology is one of the areas that business leaders can encourage citizens to get involved in those type of businesses, those type of education levels. Also agriculture in the United States. You have dairy farmers here who have had to get rid of their milk production. You've had farmers here who've had to get rid of crops and who don't know when their crops will come back. In the Caribbean, if there's any land that's available for food growing, and then import, export. All those things tie in because your infrastructure needs to be based on proper technology to do this. So I can't say enough about the role of technology and artificial intelligence in the Caribbean for being able to move forward in a new norm that we're going to see coming out of this. And so those are some of the areas where hopefully people in the Caribbean and the diaspora, again, will set up people on task force to identify people who have interest, who have businesses already. Also medical technology. You may not see tourism in the fashion that we saw it before. People have realized that the healthcare system in England, Canada, and the United States is not what people thought it was. They also, you would never hear in America of a hospital running out of ventilators and face masks and gowns for doctors, but that's what's happening. So if people in the Caribbean have businesses where they're producing gowns, medical supplies, those type of things, those are the things that I'm hearing from press briefings, from business leaders who are trying to get the word out what their needs are and what they're looking for. So if any of that is helpful, I hope that I can provide more information if there are people out there that I can connect with others to try to get these type of industries developed and moving forward. Again, as I said, phase 3 coming out of this, what it looks like in the future. Technology and artificial intelligence is the foundation of all of those.
Thank you. Melinda, the next question or group of questions?
Well, I do believe that Dr. Slater has definitely addressed, as he said, the questions that were asked. He did try to answer them as we went along. And
okay, but, can you tell us one or two that our panelists might address?
I am going to ask, somebody asked, one second. What safeguards will be put in place to ensure that procured supplies will not be seized by the United States for its domestic use?
Yeah, I think that's a very valid question because, I think I'd love to hear Dr. Slater address that.
Yes,
and Dr. Van West Charles from the medical perspective, and perhaps the Consul General of Trinidad as to this policy, which is certainly unconscionable, particularly when a lot of it is just transiting the United States and not necessarily, produced in the United States. Though in one or two cases, I know there was, or there were supplies that were made in the United States, but based on a particular law, they had to satisfy their local needs first. But Dr. Slater, would you want to address?
Okay, so in response to that, yes, those are some of the very challenges that Richard raised earlier in terms of procurement of vital supplies to address the disease. And one of the reasons why I also stated that we thought that the Pan American Health Organization, as the regional arm of the WHO, might be best prepared to address that. As Richard will know, the PAHO has a major warehouse facility in Panama, because PAHO covers the whole of the Americas. And we have already been discussing with them that the possibility of doing transshipments through, let us say, Panama instead of through the U.S., because a lot of these supplies come from out of the region, either Asia, China, or from Europe, and they come to North America and then re-shipped. And yes, the law that was implemented recently has affected that. So that's one way we are trying to work around. And as I said, we had a meeting just yesterday, the day before, with the WHO Director General, and those issues were raised. So we are working on that. Also, our heads, at the last heads meeting, we are in discussions with some partners outside of the region where we are using our diplomatic lines and other connections with considerations of moving certain products from Europe, but to be brought directly to the region. I can't say more because nothing is finalized yet, but that's the idea, so that we will not risk our products being intercepted, delayed, or anything like that. But certainly it is a challenge, and we hope that we will be able to get around that. So yes, we are aware and we are working on it. And that's one of the challenges. Sometimes things are being done behind the scenes, and this is an opportunity for us to know the work of the institutions and the policymakers, because there's a lot of negotiations going on behind the scenes that the public isn't aware of. Over.
Dr. Laverne Mc Gee, on that issue?
Well, I think, I made my comment some time ago that this is an unconscionable and inhumane issue on the part of the United States. However, I think this is where I feel that we have in each of the territories, once orders are placed, that we have to inform the U.S. representatives within the embassies in our territories and also inform our embassies in the United States to support whatever efforts, if the purchase is from within the United States and if it's being transshipped to the States. So I think we now have to try to use all of the forces that are available to us. It seems as if there's sometimes a disconnectedness within the U.S. in terms of the agency's understanding of their own laws and rules, and may vary from state to state. But I think we have to ensure that the ambassadors to our territories are brought abreast with what is happening and given all of the details. And our ambassadors in the United States also need to be brought up the board in terms of the orders with specificity when they're coming, so that they can play a role in this process. It is new, will be new for them in many cases, because the dynamic in terms of trying to get these supplies in will be critical. So there are some other things you can go after, but I would prefer to see how we will move forward using these other channels that I mentioned, together with what Dr. Slater had mentioned.
Would the Consul General of Trinidad want to say anything on that issue?
Not very much. I can just two things really. I can mention a personal experience that I had recently, in which masks were sent to my official residence here in Westchester, New York, for use by the members of staff, because of course we need to be protected so that we could serve our nationals. And they were sent by express courier, and to date I haven't received them, and this is 3 weeks ago. And we've checked on them, and we were made to understand that there is no movement inward or outward as far as medical equipment. These masks are considered medical equipment, so they don't just go by customs. The FDA has a look at them too, and so the masks have, well, for all intents and purposes, seem to have been requisitioned. And the unfortunate thing also is that, according to my knowledge, there's at least maybe 4 or 5 Caribbean diaspora organizations that tend to make donations of medical equipment to various countries in the Caribbean. And when such a policy, such a measure is in place, it's certain that those donations, and I'm sure as far as I know, there was a desire to make such donations, and this of course would be curtailed by this policy. So yes, we consider it inhumane and insensitive and insular, but this is well, fortunately, I could speak for Trinidad and Tobago. I know that we don't have it's not a major concern as far as masks are concerned, and other protective equipment. That hasn't been flagged to me as a major concern right now, but I'm sure it would be for some of our neighbors. So it is unfortunate. It's pretty unfortunate. Yeah.
Okay.
May I just quickly add to that? The question of supplies that are of concern. Masks may be low on the totem pole for more than one reason. But I think where the challenge